Marcus, and I'm going to be teaching about lumbar traction. The definition of traction is a mechanical force applied to the body in a way that separates the joints, surfaces, and elongates the soft tissue. The benefits of lumbar traction helps with joint distraction, helps with disc protrusion, helps with soft tissue stretching, helps with muscle relaxation, and helps with joint mobilization. The contraindications and precautions for traction is, first, the contraindications. When motion is contraindicated, acute injury or inflammation, joint hypermobility or instability, peripheralization of symptoms with traction, and uncontrolled hypertension. Precautions for traction would include diseases affecting the spinal cord such as tumors, infection, rheumatoid arthritis, osteoarthritis, and prolonged steroid use. When pressure of the belt may be hazardous, such as patients that are pregnant, hiatal hernias, vascular issues, and osteoporosis, displaced annular fragments, medial disc protrusion, and when traction fully resolves severe pain, claustrophobia, inability to tolerate supine or prone position, and disorientation. And I'm going to show you the setup of lumbar traction. So here we have a patient who is a 25-year-old male that has lower back pain due to muscle spasms for the past few days. And right now we're going to set him up for traction. So first things first is making sure that the lower belt is in line with the iliac crest. So then after it's in line, which it is, I'm going to tighten it by crossing it over. Not to be too tight, but snug. Is it okay?
Mm-hmm.
Well, good. Next one is going to be the thoracic belt. So the same thing. I'm not going to make it too tight. I'm going to cross over. Okay. Can you breathe? Are you okay?
Perfect.
Perfect. So I want to make sure just beforehand that his body's between the opening space for the table, which it is. Since it's just a muscle spasms, we're going to be just generalizing just the posterior musculature of the back. Right, next I'm going to tighten the belt. What to do is we're going to clip this on the metal ring, and since this is muscle spasms of the posterior back, we're going to prop his legs up. And it should be flexed. Next thing we do is we're going to release the rope, making sure that it doesn't hit the prop up, and then we're going to tighten the rope, and we're all set. Parameters for lumbar traction for muscle spasms. So first we're going to go to lumbar traction. Going to edit. We're going to do intermittent. We're going to have 0 progression, 0 regression. Time should be 20 minutes. Now goes for the force. Patient is 160 pounds. Max body weight will be 25%. Minimum should be 12. Hold time would be 5 seconds on, 5 seconds rest. Speed would be 100%. Now we give the emergency button to the patient. Treatment, I'm going to check the patient, see if he's okay. Educate him just to make sure that he has the call bell, so he can press the button to stop the machine. And now since the treatment now is over, so I'm going to unstrap him, lock the table up. And what should he be experiencing is reduced muscle spasms, reduced pain, and I'm going to check to see if he has increased range of motion in his lower back. So has your pain decreased?
Yep.
And the muscle spasms, have they resolved somewhat?
Yeah, I feel better.
Excellent. So then my next course would be to check to see if his lumbar flexion extension has improved, and then stay with the treatment or progressing from there.